All right, today we're talking about patient positioning, how important it is to our patients in the right position so we can give good dental treatment. Kids require to be in the right position for us to be able to do a good job, and so I want to talk today about a few things you need to make sure to do that. So we have our patient in the chair. One today is our patient. He's sitting upright, and of course we've talked to him, and now we're going to start to lean them back. So Cassandra's running the chair, and the first thing to get our patients in the right position is to get our patients to be laying down so the chair is basically flat in a completely horizontal or parallel to the floor position, all right? Now, the older our patients are, the more uncomfortable that feeling feels. We're not used to laying flat. So as you're teenagers, you might see they get a little unsettled by that feeling, but you can see how the chair is pretty much flat. For a child, though, that's a very normal feeling. So getting in this position is really important. Of course, for our patients, though, we have this really key thing, the television, all right? You can see right now where the television is positioned, and if they want to watch the TV, what I'd want to do, her head has to tip down, her chin has to go down, which isn't necessarily a good thing for us. We want their chin up and their kind of head back, and so what you're going to need to do is to take this TV and you're going to need to move it and position it so it is both up and back behind the patient in this direction, okay? When that happens, you can see their chin comes up, it makes it easier for us to see, and they're now basically in the right position, all right? Now that we've got both their bed flat and the TV in the right position, look at the head and neck. Some of our chairs have adjustments that here, you want to make sure they have a good neck extension. Their head is still not tipped down, push forward or back and that. They have a nice even and flat spine, all right? Then, when we're of course going to be doing some treatment, we're going to have our nitrous nose. And the trick is to have the patient's head pretty much flat, so when the nitrous nose goes on and slides on, that the tubes go straight down. And you can see right here in this position, the tubes pull straight down. If the tube is pulling this direction, or it's pulling this direction, you know that we're probably not getting a good seal on the patient's face. And so you want to make sure that the tubes go on and are pulling straight down on the patient just like that, okay? So once you've got these things in this position, our TV in the right position, that allows us also to get our light in the right position. And the last thing is turning that light on so it comes and it shines basically right on their chin, so the very top part hits their mouth. And you've got the light not shining through their eyes, they're nice and well protected, and you got your patient in the right position. That's it.